Hello everyone, I am Dr. Jordan. Has someone you care about begun to show subtle yet concerning changes over the past year? It's a question many of us dread, yet it's one we must ask ourselves with kindness and reflection. The reality is that many people think that death in old age comes all at once, as a shock. However, in truth, the body often offers quiet signals months, or sometimes even a year, before life draws to its conclusion. These signals may initially appear as ordinary, everyday events, but they can hold far deeper meaning. The painful reality is that most individuals overlook these signs because they seem so trivial, so easy to disregard. It's only later, when looking back with sorrow, that families recognize those clues were present all along. But by that point, it may feel like it's too late to prepare. Too late to create those invaluable final memories that truly matter. In this video, we're going to discuss 7 important signs that typically emerge a year before an elderly person passes. Some of these might be changes you've noticed but dismissed as a normal part of aging. Others could be subtle shifts that seem small but in reality reveal the body's gradual decline. Recognizing these signs early is not only about being aware, it's about giving yourself the opportunity to offer better care, treasure meaningful moments, and, above all, ensure that your loved one's final chapter is filled with comfort, dignity, and tranquility. Stay with us until the end, because these 7 signs can help you prepare, both emotionally and practically, for what lies ahead. When you understand what's taking place, you won't be caught off guard. Instead, you'll be equipped to make the most of every precious moment you have left with those you love. Now, let's dive in. Number 1. Extreme fatigue and weakness. One of the most noticeable changes in the year before the end of life is a profound, relentless tiredness that doesn't improve with rest. This isn't just a bit of drowsiness after a long day. It's a profound exhaustion that turns even the simplest tasks into overwhelming challenges. Getting out of bed becomes a struggle. Crossing the room takes energy, and everyday activities like cooking, dressing, or even having a basic conversation can become utterly exhausting. This isn't merely a part of normal aging. It's a signal that the body is conserving its remaining energy. As organs begin to slow down, the body focuses only on what's most important. The heart doesn't pump as forcefully, circulation weakens, and muscles are deprived of the oxygen they require. This is why many elderly individuals in their final months feel fragile, unbalanced, and unable to keep up with their regular activities. It's also why some older adults need longer naps, have trouble staying awake, or experience sudden drops in energy. Feeling fine one moment, depleted the next. But perhaps the hardest part of this journey isn't physical, it's emotional. Many older adults, who once took pride in their independence, start to feel frustrated, even ashamed, by their inability to do what they once could. They may withdraw from conversations, skip social events, or stop engaging in activities they once cherished. Not because they no longer care, but because they simply lack the energy. For families, watching a loved one shift from active and involved to tired and withdrawn can be heartbreaking. It's easy to mistake this for laziness or the need to push through, but the truth is, forcing them to be active won't help. What's most important is recognizing their limitations, allowing them to rest when necessary, and making their remaining time as comfortable as possible. If you notice a loved one experiencing deep, persistent exhaustion that doesn't improve with rest, take it as a sign that their body is undergoing significant change. This is the moment to cherish conversations, create peaceful moments, and support them without demanding too much. Because in the end, what truly matters isn't how much they can accomplish. It's that they feel loved, understood, and at peace. Number 2. Sudden decline in mobility. One of the more noticeable signs that someone may be approaching the end of their life is a sudden and noticeable decline in mobility. This change often appears when a person who was once active or able to walk with ease suddenly becomes unable to do so without assistance. At first, you might notice them hesitating to get out of bed, struggling to stand up, or needing help walking short distances that used to be easy for them. This reduction in mobility is linked to several factors, including muscle weakness, joint pain, and decreased blood flow. The body is conserving energy, and the person may feel physically drained, which makes even the simplest movements feel exhausting. In some cases, this may also be a sign that their body is beginning to shut down, and the energy required for basic physical activity is no longer available. If you notice that your loved one is moving less, unable to walk without support, or avoiding physical activity altogether, it's important to recognize that this is a significant signal of their decline. Instead of pushing them to move more, focus on providing comfort, reducing the physical strain they're experiencing, and ensuring their surroundings are safe and supportive. The emotional toll on the person as they lose their independence can also be profound. They may feel frustrated or upset about their physical limitations. Offering them patience, compassion, and reassurance can help them feel more at peace during this stage. In summary, a sudden decline in mobility can be a powerful indicator that someone is nearing the final stages of life. Recognizing this change and responding with empathy and care can ensure your loved one feels supported and loved during this challenging time. Number 3. Significant weight loss. One of the first and most telling signs that someone may be approaching their final year of life is unintentional weight loss. Initially, it may seem like a minor change, perhaps a belt that feels looser, clothes that no longer fit as snugly, or a once strong appetite that begins to fade. For many families, this is brushed off as just a normal part of aging, something inevitable, almost expected. But the hard truth is this: losing weight without actively trying is rarely a good sign. It often means that the body is not absorbing nutrients properly. Muscles are shrinking, and vital systems are beginning to slow down. While aging can cause some muscle loss, when it happens too rapidly, it signals that something more serious is occurring. The body may have difficulty digesting food properly or may no longer process protein as effectively, leading to weakness. This loss of strength doesn't only make movement harder, it also increases the likelihood of falls, weakens the immune system, and makes an individual more vulnerable to infections. Then there's the change in appetite. Many elderly people simply stop feeling hungry as they once did. Their sense of taste diminishes, food no longer brings them pleasure, and they start skipping meals, eating much smaller portions. This isn't merely a preference, it's the body's way of signaling that it's slowing down. The brain's signals to seek food are no longer there. The result is less energy, less strength, and a steady decline in overall health. Underlying medical issues also contribute to this. Weight loss is a common symptom of chronic conditions like cancer, heart failure, or kidney disease, illnesses that can develop silently long before more apparent signs appear. Even mental health challenges, such as depression or memory loss, can cause a person to eat less, triggering a cycle where the body isn't getting the nourishment it needs to function properly. For families, the instinct may be to resolve this by encouraging their loved one to eat more, offering favorite foods, or adding protein shakes. This seems like the right thing to do, but if the weight continues to drop despite these attempts, it's crucial to understand that this isn't just about diet. The body is preparing for something bigger. At this point, forcing large meals may not help. What matters most is offering comfort, easy-to-eat foods, and plenty of hydration. These simple actions can make a far more significant difference in preserving quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or having difficulty staying active, pay attention. This isn't merely about appearance. The body is sending a message. Understanding this now can help you prepare for what lies ahead with compassion, clarity, and the ability to make each remaining moment meaningful. Number 4. Major changes in breathing or circulation. One of the most obvious signs that the body is nearing its final stage is a noticeable shift in breathing patterns and circulation. You may observe that your loved one is breathing more slowly or shallowly than they used to. Sometimes there may be pauses between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience a breathing pattern known as Cheney-Stokes respiration, where rapid, deep breaths alternate with long periods of no breathing. These changes may begin gradually, but over time, they become more noticeable and happen more frequently. Another common indicator is weaker circulation. You may notice that their hands, feet, or even their nose and ears feel cooler to the touch. Their skin might appear pale, bluish, or have a mottled appearance, especially around their fingers and toes. This occurs because the body is prioritizing the flow of blood to the essential organs, reducing circulation to the arms and legs. It's a clear signal that the heart isn't pumping as effectively as before. Some individuals also experience increased shortness of breath, even with minor movements. Simply sitting up, talking, or changing positions might cause them to feel winded. You may notice they start breathing through their mouth more often, or they may need to pause and catch their breath while talking. If they were once able to walk across the room with ease but now struggle, their lung function might be weakening. In some cases, fluid buildup in the lungs can make breathing more difficult. This may lead to a constant cough, gurgling sounds, or a sensation of tightness in the chest. While many people assume this is just a cold's congestion, for elderly individuals nearing the end of life, it's often an indication that the lungs are failing. Lying flat may feel uncomfortable, and they might prefer to sleep propped up on pillows or in a recliner to make breathing easier. For family members, watching these changes can be frightening. It's natural to want to assist, to encourage deeper breaths, or to worry that something more serious is occurring. However, in many cases, this is simply the body's way of slowing down. There might not always be a way to prevent these changes, but there are ways to make them more manageable. Keeping the room cool, using a humidifier, or offering small sips of water can help alleviate discomfort. In some situations, medications or oxygen therapy can provide relief, but the primary focus shifts to comfort rather than attempting to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often signs that the body is conserving energy and circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where your loved one feels safe and cared for. Number 5. Increased confusion or withdrawal. As a person nears the final stage of life, one of the most noticeable shifts is in how they think, speak, and interact with others. You may see someone who was once sharp and involved now starting to forget things more frequently, struggling to follow conversations, or appearing disoriented in places that were once familiar. They might repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These subtle cognitive changes may begin months or even a year before death. This isn't simply normal forgetfulness. Like any other organ, the brain requires a consistent supply of oxygen and nutrients to function optimally. But as blood circulation slows and oxygen levels decrease, the brain's ability to function deteriorates. The person may become easily confused, have trouble making decisions, or even struggle to recognize people and places they've known for years. In some cases, they may experience brief moments of clarity, followed by sudden episodes of confusion, almost as if their mind is fading in and out of focus. Another common sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them talking less, engaging less, or spending long stretches of time sitting in silence. It's not that they don't care about their loved ones. It's simply that their brain no longer processes emotions and interactions in the same way. Conversations can become exhausting. Noisy environments feel overwhelming, and many elderly individuals begin to retreat into their own world. You may also see shifts in mood and behavior. Some may become more irritable, anxious, or easily frustrated. Others may appear unusually calm, detached, or uninterested in things they once enjoyed. This isn't just a change in personality. It's often the brain adapting as the body declines. As mental function slows, expressing emotions becomes more difficult, and the person may stop reacting the way they once did. For family members, this stage can be especially heartbreaking. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're truly gone. However, it's important to recognize that this is something beyond their control. Instead of trying to pull them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer comfort, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming increasingly forgetful, more confused, or less engaged, don't overlook it. These are often early indications that the body and mind are preparing for the final transition. This is the time to be patient, savor quiet moments, and focus on making their surroundings feel safe, familiar, and serene. Because even when words fade, love and comfort can still be deeply felt. Number 6. Changes in sleep patterns. One significant sign that someone may be nearing the end of life is a noticeable shift in their sleep patterns. You might observe that your loved one is sleeping more than usual, having difficulty staying awake during the day, or experiencing disturbances in their sleep at night. This change is often due to the body's natural decline, as it begins to conserve energy in preparation for the final stages of life. People in the final months may sleep for longer periods, and it might become harder for them to wake up fully or stay alert for extended times. They may nap frequently during the day, or conversely, they may experience restlessness and insomnia at night. This irregular sleep cycle can be attributed to changes in brain function, hormonal imbalances, and reduced energy levels. For family members, watching a loved one sleep more or struggle with sleep can be concerning. But it's important to understand that these changes are a part of the body's natural process. If the person is still able to sleep peacefully, this can be a sign that they are receiving the rest they need. However, if they seem restless or uncomfortable while sleeping, providing a calm and soothing environment can help them feel more at ease. Rather than attempting to fix the sleep disturbances, focus on making them comfortable, creating a peaceful sleeping environment, and allowing them to rest when needed. Recognizing these changes in sleep patterns early on can help you better understand your loved one's needs as their body prepares for the next stage of life. Number 7. Frequent infections and slow healing. As the body begins to shut down, one of the most apparent physical signs is a weakened immune system. You may notice that someone who rarely got sick before now catches every cold, flu, or minor infection that circulates. What were once small illnesses now take much longer to recover from, and even minor wounds, like a cut or bruise, heal more slowly than before. These changes are not coincidental. They signal that the body can no longer protect or repair itself in the same way it once did. One of the main concerns is the increase in repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families think these are isolated health issues, but when infections happen frequently or take longer to heal, it usually indicates that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, extended recovery times, or multiple courses of treatment for infections that once would have been minor. This occurs because, as blood circulation slows and organs weaken, the body simply doesn't respond to treatment as effectively as it did before. Another factor to consider is chronic wounds. If you notice that small cuts, sores, or bruises aren't healing properly or continue to reopen, it could indicate that blood circulation is impaired. Poor circulation prevents oxygen and nutrients from reaching the skin and tissues efficiently, causing healing to be much slower than usual. Bed sores, particularly for those who are less mobile, become a serious concern and can lead to severe infections if not carefully managed. What's even more concerning is that infections in the final stages of life often don't present in the expected way. Instead of a high fever, an elderly person might simply appear more tired, more confused, or less interested in eating. For seniors, a sudden drop in mental clarity is often the first indication of an infection, even before other physical symptoms appear. Recognizing these signs early can make a significant difference in providing comfort and appropriate care in their final stages. For families witnessing a loved one go through recurrent infections, it can be both disheartening and heartbreaking. The instinct to push for strong treatments, hoping that one more round of antibiotics or another hospital visit will resolve the issue, is natural. However, at some point, the focus tends to shift from curing to offering comfort. Ensuring they stay hydrated, keeping their skin clean and moisturized, and minimizing physical strain on the body can do more for their well-being than another round of medicine that may only contribute to their discomfort. As we approach the end of this video, let's take a moment to reflect on the key points we've discussed. Extreme fatigue and weakness, sudden decline in mobility, significant weight loss, major changes in breathing or circulation, increased confusion or withdrawal, extreme fatigue, memory problems, changes in sleep patterns, frequent infections, and noticeable changes in breathing and circulation. These 7 signs often appear in the year leading up to an elderly person's passing. They may not all occur simultaneously, and at first, they might be subtle. But once you begin to notice them, it indicates that the body is preparing for its final stage. For many families, these changes can be difficult to come to terms with. It's natural to want to resist them, to encourage a loved one to eat more, move more, or push through the exhaustion. However, sometimes the kindest thing we can do is listen to the signals their body is giving us. Rather than trying to prevent the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Recognizing these signs isn't about fearing death. It's about being ready for it. When you identify these changes early, you're better equipped to provide the right care, make thoughtful decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time to savor every moment, share precious memories, and remind them that they are loved and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you don't have to face this journey alone. Many families have walked this path before, and while it's never easy, understanding what to expect can provide you with strength, patience, and peace. Thank you for being with us today. We'd love to hear from you. Leave a comment below to share what you've learned and how you plan to use this information in your life. Your thoughts are important to us, and reading them motivates us to keep going. If you found this video helpful, please like, subscribe, and share. Your support allows us to keep creating valuable content to inform and inspire. Thanks for watching, and we look forward to seeing you in our next video.